Welcome back to True Vine Talks with Linda and Rachel. Today we have our guest who is Josh Parker. Josh, you want to tell us a little bit about you and your practice?
Hi, my name is Josh Parker, and I am the director at a place called Infinity PLLC, and I'm actually an LPN. So we help people get off of drugs, and we help people with their mental health.
Well, thanks for joining us. And so, what are some things that you want to share with the listener about addiction and mental health?
Sure. I guess we can start from the beginning. So I guess if you think about how we got here, where we are now, and where we're going, they're three completely different things. I think how we got here is there's a lot of reasons that we got here. There's a lot of pill mills, and Florida happened in about 2008, where a lot of people from the local area were driving down to Florida and getting all these pain pills and bringing them back. And then there was a lot of people prescribing pain pills, but a lot of them were legitimate. When the vital signs came out with the fifth vital sign, it was the little smiley faces that you guys see. And anything that was rated over a 5 with the smiley faces, the people got their pain treated as well. So kind of before the 90s, there wasn't the fifth vital sign. And a lot of people just got a Band-Aid and, a shot in the butt, and they got their exit papers.
Yeah.
But somewhere from the 90s to the early 2000s, that fifth vital sign created a monster. So people would leave with a prescription for pain pills. And those were legitimate. Like, dentists were the number one prescribers of pain pills for the longest time there.
Wow.
Yes.
I didn't know that either.
And then Florida, out of all the states, they weren't regulated with the database where people were getting pain pills. So there was a lot of people up here driving down, making it a whole full-time job, getting pain pills. I mean, they would get hundreds and thousands even of pain pills and drive back here, and they would sell enough to go back to Florida again, and they would use enough basically just to get addicted. And then over the years that's progressed exponentially, and that's kind of where we are now. So there was a lot of before all that happened, when somebody went into rehab, they would assume, they'd be like, oh my gosh, they smoke crack, or they would just say something general, because that's all we saw on HBO and stuff like that. And nobody really thought people on marijuana were addicts. They just thought, oh my gosh, I can't believe it. But now when you think somebody's on drugs, you think heroin, meth, and that's really changed here in the last 15 or 20 years. So where we are now is, right now, we're in Hurricane Taze Valley. I think from Charleston, West Virginia to Portsmouth, according to the addicts, it's the most addicted place in the whole United States as far as meth and heroin, because of the boom in the 90s and early 2000s. So there are limited programs for treatment, and I think a lot of people misconstrue it that the people working in addiction need mental health, because addiction makes your mental health way worse. And with depression, anxiety, bipolar, ADD, ADHD, and a bunch of other letters. And then your mental health makes your addiction worse. So especially, I heard you guys' True Vine talk on seasonal affective disorder.
Yeah.
And there are a lot of relapses during those dark days. And I'm talking about relapses where people just completely fly off the handle and completely go back out there in active addiction again. Not just relapse once or twice, because they can't deal with it. It's darkness, it's low energy, it's low mental energy as well. So I guess that's where we are now. Then where we go from here, we got to figure out how to bridge the gap and work together, because I think we're all on the same team. We just approach it differently. Like, some of the physicians utilize meds, some of the mental health physicians utilize psych meds. Then there's methadone, suboxone, there's Campril, there's Vivitrol, there's a new medication called Suboxone. There's all kinds of different medications. What those medications for, there's two different beasts. One of them is getting off drugs, and the other is staying off drugs. And those medications are targeted for helping people stay off drugs. And some of the people use just medication and they fail. The people who use medication along with mental health counseling, they're the people that really succeed. So I guess that's kind of where we are and how I got here.
You have any questions, Rachel?
For the listeners as well as myself, can you kind of say the names of some of the medications that are for staying off drugs?
Sure.
Because I get confused with that myself.
Sure. So the gold standard it always was methadone. That was the only thing. And what that came about was the harm reduction model. So the harm reduction model says that if you're going to use, let us guide you and let us dose you. So people became addicted in the Army and the military and stuff, and they came back to the States, and they were going crazy, because if you would go over there to the war, I think it's like the Gulf War and other, if you had a headache or something, I mean, it was a little bit more severe than that. Morphine was the number one prescribed drug over there for that stuff, according to research indicates that. Then when they got back here, they were addicted. The VA is overflowing of people that were addicted because of normal stuff, mental pain, physical pain, emotional pain, and they would treat that with morphine and other high potent opiates. So the methadone clinics were created, and the harm reduction model says if you come here and we dose you, it minimizes you using street drugs. And research indicates that that's okay. So somewhere along the line, I don't know exactly what year it was, I think it was 2001, a company called Reckitt Benckiser, and they were the company who actually made Lysol and Rid-X. They made Subutex and Suboxone, and they started it out in England. So it formulated, by the time it got to America, it was a medication. It's a little bit of opiate, and it's a little bit of opiate blocker. They designed it to where it tricks your brain into satisfying those mu receptors in the brain. It tricks them into thinking that they've used, as well as it has the blocker there, so you don't really get high. Now, don't get me wrong. If you took a handful of them, you'd probably feel some euphoria, but there'd be so much Narcan in it that you'd probably get sick. So that was kind of the second medication that came out. Vivitrol is a medication. So methadone is the full opiate. The difference between methadone and Suboxone is methadone doesn't have a ceiling effect. So you can take a bunch of methadone and you can overdose on it. In fact, the biggest drug to overdose on for the longest time was methadone mixed with benzos. And I think it was until 2007 or so that people really were overdosing on methadone and benzos, in West Virginia at least. And then in the middle was Suboxone with a little bit of opiate, a little bit of blocker. So full opposite end of that spectrum is Vivitrol. Vivitrol it's kind of like Narcan. It's a full opiate blocker. It's naloxone, which is Narcan, but it's in liquid form and powder form that you mix together. So it's a once a month injection. But with all three of those medications, therapy is suggested to help the person. Whenever you're on those medications, they kind of buy you time. Now, what you do at that time, some people are just taking meds and they're off of drugs. But to completely get abstinent and stuff, they need some life changes, and that's where different therapy comes in. So Vivitrol is a once a month injection, and it was very successful. It's made up of stitches that go in your mouth, and you get a shot in the butt once a month, and it slowly disintegrates over about 32 days. It is a great medication. It's great. It's not for everybody. Suboxone is a great medication, and methadone it works too. So, is it a great medication? The people that are on it and successful off of opioids, yes, it's a great medication.
Yeah.
But with the treatment is the only way it works. So Vivitrol's out there. Campril is medication that helps people stay off of alcohol and helps with alcohol cravings. There are several other medications on there, like there's generic Suboxone now. There's a Suboxone only a certain. There's a medication called Bunavail that it goes into the buccal. It goes into the cheek. Suboxone goes under the tongue. Methadone it's kind of a juice. It's a liquid medication, and then Vivitrol has a pill form called naltrexone, and it is a tablet form. So the new medication now is called Sublocade, and it's kind of injectable Suboxone that goes into your stomach. And it slowly disintegrates over about 34 days or so. And it does not have the blocker in it. It is just straight Subutex. So those are the different medications that help you stay off.
Thank you.
My pleasure.
So well laid out.
Yeah.
Love that. No
And
one's ever explained it so succinctly before.
Good
Yeah,
work,
Thank you.
Rachel.
I've been doing that.
Yeah.
I've been in that treatment program since about 2007. And then I was in the beginning stages. We started the Suboxone program at a local mental health center February 25th, 2008. And it grew where we had 7 physicians all over the state of West Virginia. We had over 300 patients. And one of the first things we had to do was we had certain physicians that just treated their substance abuse disorder. And then we had other physicians that would treat their mental health. And then we had therapists that would help them with their life skills. So it was a treatment team effort, and we utilized the patient to see where they needed to go. And I really think after all of the time I've ever been in the programs and been in this type of business, there's only two ways to get addicted. And that is partying and pain. Now, partying is that recreational user that maybe you're in high school or college and you see that one guy that's at the party and you're like, whoa, bro, you need to chill out. That guy ends up taking it overboard, and he damages his opiate receptors to where they I'll explain that in just a second. But the second type is pain, and there's two types of pain: emotional pain and physical pain. For instance, like the mechanic who bent over one day, 20 years on the job, and he can't stand up. He walks into the doctor's office and they give him pain pills. Now, they don't give him back surgery the first day, but they give him pain pills, and he feels amazing. It helps his back. He can function. And a couple years later, he wakes up and he doesn't have those pain pills, and he has crazy nausea, vomiting, diarrhea, back pain, leg cramps, stomach aches. It's really bad flu symptoms is what withdrawal is. And then the emotional pain is like that girl who got raped by a family member for years on end, couldn't tell anybody, and the way she copes with that is by utilizing heroin and opiates. And basically what addiction is there's four hormones in the brain that kind of control your life, and that's serotonin, dopamine, oxytocin, and adrenaline. So with addiction, it's just your body's inability to produce those naturally. For instance, like, when you're 12 years old and you go to Kings Island and you're almost there and you see the Eiffel Tower and you're like, oh my God, we're here. So that's your body secreting those fluids into your brain, and your brain controls your body. Whenever the opiate addicts would utilize the synthetic serotonin and dopamine over and over and over, their brain stopped producing that on its own. So that's what addiction is. It's your body's craving for serotonin and dopamine. And physically, your body will absolutely shut down if it doesn't have serotonin and dopamine. And it really looks like, the way I explain it to people is they think, well, why don't you just quit? Awesome idea, bro. We never thought of that.
Would love to.
Yeah.
That's ideal.
It's when somebody doesn't have opiates and they've been using that long, it's almost like the person is dying in hospice care about every 12 hours, and it's terrible. I've worked in detox where people would rather kill themselves than to stay off of opiates, and it's tough. And then when they get in there and they get a clear head after 7 or 10 days, people think that if they stop using for that long, they're good to go. There is nothing further from the truth. Getting off drugs is easy. Staying off drugs is the hardest thing we battle as a community. We have to be part of that solution instead of part of the problem. Our expectations and pressure on those people, it's insane. And we base those off of our own experiences. Why don't you just quit? I'm sure they've thought about that every single time they've used, but it takes a village, I guess.
Yeah. And I love how you have so much empathy and care for them. For not just, just for anyone that has an addiction. That's an amazing thing to look at them in the way you just described, not like as a problem.
We've had people die, and it's just, research indicates that 100% of opiate addicts are human beings.
Of course, yeah.
And a lot of the times the public doesn't treat them like human beings. I've seen a guy die in the lobby of my previous job.
Wow.
I watched a man. It's the worst feeling ever. And he had kids, but he thought in order to get into the treatment program that you had to use drugs. So he thought you had to be dirty to be in treatment. Wow. Which some treatment programs you do have to have a positive urine screen, so they can justify diagnosing you with opioid addiction. So he used a bunch in the parking lot, and when he came in there, it all hit him at once, and it was terrible. I mean, it was just a terrible thing. So, like there's certain people that want to. So certain people say, well, if you're using one of those medications, it's just trading one for another, and I hear that all the time. It's trading one for another. It kind of. It's trading a lifestyle that's completely amiss. And the number one thing is when you're an addict, the first step of the Narcotics Anonymous says, my life has become unmanageable.
Mm-hmm.
So with the medications, we try to help you manage your life, and that's what it is. It's about control.
Wasn't that the same like with insulin and you're diabetic?
It is exactly the same. It's exactly the same. So no, this is not for all the types of diabetes, but for the majority of diabetics is they haven't controlled their diet or exercise for the longest time, and then their body, their pancreas doesn't produce insulin or regulate it. So they have to take medications like metformin, and they have to have injections. You know what? And nobody says anything to them. Do we feel sorry for them? Maybe a little. I mean, but we just kind of let them stay on the medication because they're not out there dying every day and losing toes. My dad had diabetes and ended up dying from it.
Yeah.
You know, so but society didn't be mad at him for being on medication as long as he was off of insulin. You know, so I don't know. But people that are on suboxone or on methadone or on Vivitrol, for the most part, are off of heroin. And they're off of opiates. Mm-hmm. So if a patient comes in and their goal is to get on suboxone, they never make it. But if their goal was to get off of opiates, they always make it. Mm. Now, I'm not saying they have the perfect record and don't relapse from time to time, because it happens.
Yeah.
You know, I mean, like the anniversary of their dad's death, or the holidays, they're hard. It's just hard.
Yeah.
So I think we're here at the beginning of the year. It's January 3rd.
Yeah.
The biggest time for relapse is Thanksgiving, Christmas, New Year's. There are more people that relapse during that time than any other time of the year. And I don't know if it's seasonal affective disorder or financial stress or relationship stress or whatever it is, but for all the programs I've ever worked at, we usually lose about 10 to 12% of our patients during that time. And it just happened this year, and we've lost about 10% of our patients where I work now. And people are starting to call in January. Some of them, if they've relapsed, they're ashamed to come back. Some of them aren't. Some of them say, "Hey, I messed up. Can I come back?" And we're like, "Of course. I'd rather you on this side of the door than the other side." Mm-hmm. So we can figure out how to regroup and move forward. You know, we don't give them the green light to use, but we say like, "Hey, listen, if you relapse, let's come in and try again. Let's go forward." So
yeah. So how do we kind of garner up that compassion that you have?
It's different for everybody.
Yeah.
You know, there are the healthcare professionals.
Yeah.
There's the patients. Then there's the public. And the healthcare professionals approach it differently. Some of the people learn only from the patients. And that's all. I've learned everything from our patients. And I've learned everything from the patients about addiction and mental health, dealing with addiction. It's insane how you can see a person one day and everything's fine. Then one thing can trigger them, and their mental health will make their addiction rampant. For instance, you know, we had a guy who watched his mom kill herself in our program. And we didn't know because he never told us. Why would he introduce that to us, you know? So he has kind of medicated and put that on the back burner for the longest time. So he relapsed, and we didn't really know what was going on. And he did get in a rampant talking spree, and he told us kind of what happened. And through motivational interviewing, we just asked him questions over and over and over and over, and we got him to tell us what was going on. And we're like, you know, why didn't you talk to us about that before? And he's like, why would I? I don't want to mention that. He's like, it's something I've tried to, you know, move forward from. And that's something he's going to deal with the rest of his life. So that is the professionals. And most of the professionals have education out the wazoo. And we have to get education every year and every quarter. And we have to have these CEUs. And we have to have all this hours of training. And then you have to have the on-the-job experience. So we're in it all the time. Some people do well with that. Some people don't. Some people, like this, I worked with this lady, her brother passed away from addiction, and she's like, well, it was just a choice. He should have stayed clean. And she was kind of resentful. So the compassion's not there for everybody. So the patients, you know, some of the patients blame themselves. Some of them blame others. Some of them blame Jesus and religion. Some of them have excuses. Some of them, they have all kinds of different reasons to use, but some of them have reasons to stay clean. And a lot of the patients have compassion for each other. The public is fickle, though. The public, wow, on the social media forums and everything else, They think suboxone and methadone and all these other medications are just as bad as heroin and all this other stuff. I want to tell you about suboxone. So, Huntington, West Virginia is famous. It was on the AP, I think it was in 2016, that a number of people overdosed in a 4-hour period. I think it was 26 or 27. All overdosed.
So sad.
That was about 1 mile from my job. So all those people overdosed. You know, we could be on the news for a lot more. We were just on the news on New Year's Eve for 7 people. It was in the New York Times. 7 people were shot at one bar at 1:30 in the morning. And that's just tough to be always on the news for that stuff. So right after those people overdosed, I think it was 26 people in 4 hours is what it was. But right after those people overdosed, a couple months later, Narcan came out. And it was just, the timing of that was just insane. So Narcan is, it's an injection that it's just an opioid blocker. That's what it is. So it goes to your receptors in the brain and it kind of blocks and pulls away the opiates just for a little while. Anybody can go to the health department and do a Narcan class. And if you know somebody that is an opiate addict, please go to your local health department. They will give you Narcan.
Yeah.
They'll give it to you every week if you want. And it really can save somebody's life. But Narcan came out right after that. So that kind of minimized the reporting of all the overdoses lately. Narcan is a great medication. Now, the public will say, oh, well, it's just a get out of jail free card. They all need to go on an island and die. Blah, blah, blah. Listen, what if it's your son? You know, what if it's what if it's your mom? So somebody.
What if it's you?
What if it's you? Yeah.
You don't know that you might be in a car accident in a year or two.
Right.
I think everybody's one accident away from being addicted to an opiate.
They are. It's one event. It could be an event that, you know, things change all the time.
That's right.
But with the medication like Narcan, it really can help somebody. You know, that guy in the lobby that day, we didn't have Narcan in the building. I wish we did, but we didn't. So he passed away. So Narcan is a great medication. They'll tell us that the more Narcan we have, we're feeding the problem, because they keep using and they keep getting Narcan and they keep, you know, Narcan is a great medication, but there's no treatment with it. There's no required treatment. If you are an opiate addict or know somebody who's an opiate addict, you can go get Narcan and you can be readily available for that. The stigma with that is that we're just feeding the monster, because they're just helping them overdose, or helping them. We know if they overdose, it'll stop it. And there's a lot of research indicating that Narcan really does save lives, but there's no treatment with it required. With suboxone, with methadone, and with Vivitrol, treatment is required in the state of West Virginia, so that's a good thing. So I guess what I was getting at is, in suboxone, the tablets are film. If it's suboxone, there's a little bit of Narcan in every suboxone. So suboxone is made up of 2 medications, buprenorphine and naloxone, which is Narcan. So every time somebody uses suboxone every day, they're using a little bit of Narcan. And if there's an addict out there using opiates, if they are 100% an opiate addict, it's probably a good thing for them to take Narcan every day. So it gives them a little bit of blocker. So I don't think the public knows that, or they realize that they're taking a little bit of Narcan every day. And research indicates that people who are on suboxone or in medication-assisted treatment, that they have less all kinds of everything. Hepatitis C is getting better with medication. It minimizes that. That's safer for the public. HIV, there's no sharing needles if you're on suboxone and you're compliant with treatment. You know, at one time, about in 2015, if you died, there was a 2 or 3 month wait to get into a funeral home. There were so many deaths related to opiates back then. So if I died today, I wouldn't get buried till March. Just what a terrible thing to do, you know. So that's a lot better now. You know, if you go into the ERs, back in the days, there were a lot of people there to go fake symptoms just to get pain pills because they were dope sick. So they'd say all this other stuff, and they would get a shot of morphine, or they would get something to ease their dope sickness. So that's not going on anymore. The lawyers and legal fees and all kinds of stuff. So everything's better when people are in treatment. And I'm not saying just suboxone. There's all kinds of treatment. There's residential houses. Those are great. Because when people are there, I mean, they get held accountable. They get peer-to-peer specialists. There's all kinds of places that people can go. And mainly when people are in there, they get mental health help.
Yeah.
So they get help with their depression, and they're not using opioids and anxiety, and that's what they utilize counselors.
Yeah. So how important is it that, we'll let you go.
No, somebody was calling us, making sure it was an emergency.
Yeah. When people are in treatment, how much more receptive are they to counseling, do you think?
It depends on the person.
Yeah.
You know, how receptive are they? Some of them have to earn trust from the counselor.
That's true.
Because when the counselor comes in and they're like, tell me about your childhood, we have grumpy old men in there. We have all kinds of different people. Some people are receptive and they open up to that.
Yeah.
Some agencies, there's a high turnover in substance abuse counseling and mental health counseling. There's high turnover. I mean, it's research indicates that. And I don't know if it has anything to do with finances or location, or it's a lot. There's counselors are held hostage almost by all the patients that they see every day, and then they have to take that home to their family, and it's stressful for the counselor too. So it depends on the counselor. It depends if they are approachable. Some of the counselors come in there and think they know everything. Some of the counselors are fresh out of school and they just try to go by the book. You know, I would love to tell you that that's the way the world works, but it's not always by the book. Sometimes when you go there and you learn a lot from people, the best thing about counseling is the longer that the counselor can stay with the patient, that's when the patients really open up and they build rapport, and that trust, that'll really help people stay off of drugs and deal with their mental health better. If the person is, we have patients that are opiate addicts from 18 to 75 years old.
Wow.
And there's a 75-year-old lady in our program, and when she came in, I thought it was a joke. I thought when I saw her birthday on the chart, I thought it was an error. And I go up to the front desk. I'm like, "Hey, is this right?" You know, birthday's 1943.
Right.
But that just shows you that it could be anybody. It could be your grandma. You know?
Oh yeah.
Yeah. And when the lady came in, I thought she was a staff member because she's well dressed. We have all kinds of different professions in our program, like lawyers. We have physicians in our program. We have nurse practitioners. We have nurses, teachers, principals.
Yeah. Substances don't have a socioeconomic, it doesn't favor one or the other.
You're exactly right. And I had that perception before I worked in drug rehab. I thought it did. I thought it was that HBO special with the guy with dirty clothes on, waiting in an alley, saying, "This is your brain on drugs." Or just
the eggs are fried.
Yeah, that's right. I really, and you know what? I've learned a lot, and I realized that it could be me. It's not me, but I'm thankful.
Could be.
I'm thankful for that
it could
today.
Be me.
It could be, because we're one accident away, like you said, from being in long-term treatment where some of the places just treat your pain instead of treating the cause of your pain.
Mm-hmm.
So they just, they give you pain pills and you're okay and you feel better, and then you really need back surgery or leg surgery, or there's all kinds of ways to get addicted as far as physical pain goes. But it's tough because we have hard workers here. The coal mines in West Virginia, man, I can't imagine. Those guys work 16 hours a day, 7 days a week. They don't even know what day it is. They're in the darkness all the time. And I can imagine some of those guys, the pain they deal with, that's tough.
Yeah.
So
having compassion for the hardworking person who may have gotten hurt.
I try to focus my compassion on human beings.
That's right.
And when somebody comes through the door, and realistically, they come in the door dope sick a lot, and they are in a bad way, and they are not the nicest people, but they're human beings. And sometimes you got to be direct with them. And I'm like, "Hey, listen, bro, I'm gonna help you out. We need to get through this first and help you get better." And even suboxone or meth, it's not some miracle medication. You're not going to take one, run around like you're chasing butterflies in a field.
Yeah.
Getting off pain pills and staying off pain pills, it's a process. It's not an event. And you have to help yourself. We can give you the tools, but you got to help yourself. For instance, you're going to have to change some people, places, and things. Mm-hmm. So I did some research last week, and I really, it's not official or anything, but people were talking about the gateway. They were talking about marijuana, and then they were talking about alcohol. And I think at the end of the day, the gateway to addiction is their environment. So environment is the gateway, because how would they even have access to marijuana? It has to be their environment, or alcohol, or even the knowledge of alcohol and marijuana when you're 12. It's the environment. So if you flash forward, the gateway to recovery is environment as well. Mm-hmm. You can't be married to somebody who's a full-blown heroin addict shooting up 5 times a day, and you can't stay clean and sober if that's in your face all the time. It's very difficult. And you can't stay clean and sober in an environment where people are using and they're making excuses to use, and it's just tough. But you can. It's a lot better if you go to a place where you feel welcome, and like a treatment program where everybody's there for basically the same reason, to stay off drugs. Mm-hmm. And like group counseling is amazing, because group counseling lets people share ideas. And some of the people that have been there for a while, they share ideas with the newbie. Because the newbie thinks, I'm afraid to come here. I'm a teacher and people don't know this. Then they go in there and they're like, I expected to see all these druggies, and I just see the professional everyday worker. Yeah. I see the norm. I seen my waitress. I seen my dentist. There's a lot of people that come and they share ideas about how to maintain your sobriety. And one of the things is you gotta make some changes with your people, places, and things, and that's tough.
Yeah.
For instance, I've been working with a chiropractor, and I think we're going to get him into our office to talk about using chiropractic care instead of using pain pills for your pain.
Holistic.
That's not the answer for everybody, but it just gives them options. Yeah. Then some people think you got to be on the marijuana maintenance program. But like, if I'm smoking weed, I'm not shooting up heroin. Yeah. I'm like, listen, bro, let's focus. So our whole goal is to help people get off of everything, stay off of everything, and even taper off suboxone and be completely abstinent. But today, as long as they're not shooting up heroin or stealing off their kids or anything to get enough money for pain pills, then it's okay. We can work with that.
Yeah. Thanks for sharing so much, Josh.
My pleasure.
We appreciate it.
Yes, we do.
Yeah.
Do you have any other questions or anything about addiction or mental health? Go ahead.
It's coming to mind, the last thing you said is just like the power of positive relationships when someone's ready and willing to give up their substance of choice.
Having
can
that
make such a huge impact.
Close bond with, kind of goes back to attachment and EFT, emotionally focused therapy, is if I can lean on you to be there for me in the right way, I can get this. I can get over this addiction. But if you're not healthy and safe, I can't do it. I can't lean on you to do it. Right. So, when we do EFT, we talk about your closest bond and how that impacts you emotionally.
Sure. So, it's easy to call somebody out on their mistakes too. If you have somebody that's holding you accountable, like for instance, it's January. Everybody wants to go on a diet.
Oh yeah.
So if you relate,
gyms are packed.
If you relate addiction to that, So the only way to lose weight and to get your fitness up is to diet and exercise. End of list. There's nothing else. You can take supplements. You can have gastric bypass. You can do any of this other stuff. Diet and exercise is the only way to keep weight off, to lose weight.
Correct.
So that's it. So the only way to get off drugs is to change your people, places, and things. Mm-hmm. And if you use medication for a while to get there, that's fine. But you still have to change your people, places, and things. That's the end of list. That's it. So you have to address some of those things. You have to address your mental health and stuff like that. But if somebody's holding you accountable, if you have a partner when you're working out, like, okay, let's go Monday, call me girl, I'll be there. 6:30 rolls around, you're like, oh my gosh, I stayed up a little late last night because American Idol was on or something like that. So they'll hold you accountable. But what about that Monday where she's there at 6:30 and you're like, hey, thanks for picking me up. The positive reinforcement is amazing. And it's okay to look at somebody and be like, man, I can really tell you're losing weight, or I can really tell you're motivated. The people in recovery, a high five or a handshake, or, I told them a couple weeks ago was Christmas. And we went over in group and I'm like, what are you getting your kids for Christmas? And some of them feel really guilty about being, an active addiction. So they were overdoing it. They're like, I'm giving my kid a trip to Belize, or I'm giving him a car and all this other stuff. We're like, wow, okay. I wasn't going there, but
what about that train?
So
little train.
the best thing an opiate addict can give their kids for Christmas is a day of sobriety.
Yeah.
When you go back and you embrace those small things, it could really make a difference. And it really is great for somebody else to tell you that they're proud of somebody for staying clean.
Mm-hmm.
While a lot of people aren't staying clean and sober today, there are people staying clean and sober. And even you guys, therapists, you have so much power in your words. A lot of people don't realize how impactful that is to the whole community, because that person affects so many other people at their place of employment. Like if they're a waitress, if you have a bad experience at a place, you're not going to go back there. So all of that depends on what you told that person in a session, and then how it made them feel. And they go out and they're like, hey, I am proud of myself because I hate my boss. I hate this other person at work, but I still go and I still stay clean and sober. Yeah. And if you guys recognize that, it's a great thing, the positive affirmations. So there's a lot. It's powerful.
Because when they walk away from their interaction with you, that's how they're going to treat all those others.
All right, and you guys give them little tools that become huge.
Yeah.
Whatever tools you're giving them. And EFT, and there's all kinds of different therapy.
Yeah.
Some of the therapists think they're more right than the other therapists.
Yeah, we're right.
Yeah, well,
we're right, Josh.
Yeah, but some of the therapists come in with an open mind. They're like, okay, I'm willing to give a little bit and take a little bit. And if this isn't work, you guys got to approach somebody in a different way. And I know you guys do that. Mm-hmm. And then when somebody gets those little tools and they go out into the community, and that's what changes the world, is one small tool at a time. Mm-hmm. You know, with a hammer, I could give you a hammer, and with that hammer, you could build a small table, or you could build a 2-story mansion. So it depends what you do with that tool. That'll change the world. So with suboxone,
it's a good analogy.
We can give them all the tools in the world, but it's the same hammer. Everybody has the same tools. They use them differently, in which way we direct them. You know, and I want to tell you one thing too. So I was watching the show. It was what's the show where they have their crab boats? The crab boats. It's the most deadliest catch.
There it is.
Oh, okay.
So deadliest catch. So it's like one of the last episodes of the season. Uh-huh. Everybody's wrapping up their boats. They're putting the cages back in, and they're like stacked 10 high, and it's, you know, guys are swinging off, and they're acting kind of crazy because they've already made their money. The season's over. So it shows a guy fall in the water.
Oh no.
So it's out of the blue too. And safety is one of the main things they preach on there. A guy falls over the water. So what happened was, of course, they tried to stop the boat, but the boat's going fast. I mean, it's just all happening in real time. It's emotional. They throw in the little styrofoam thing. Another boat off in the distance. Now listen, this is another boat, another company, turns their boat and comes straight for that guy. Because alarms are going, sirens are going. They're trying to create enough attention to try to save this guy's life. So they switch to the other boat. So the other boat sees this guy fall in the water, immediately goes straight for him. Now, one of the things they didn't say is, well, that's our competition. You know, they went straight for this guy. They got the guy in their boat. So they're hugging the guy, and it's emotional. I'm crying, like everybody on the show is crying. Oh. So I think what I got from that is, when it comes to human life, we're all on the same team.
That's right.
You know, regardless of what's going on. So I don't think people realize that in the end. Mm-hmm. We're all on the same team. So if you're a healthcare worker, or you're a patient, or you're a parent, or you're a support system, or you're just a general member of the public, it takes all of us to help people, you know, help people live. Mm-hmm. And, you know, I just wanted to feel that out there.
That's well stated.
Yeah.
I like that.
That's a good story.
Yeah, it's all true too.
Got chill bumps.
Yeah. Makes me think of that phrase, it takes a village.
Oh, it does take
really
a
does.
village.
I think often we forget that, and some of the times we try to do it all ourselves. And some of the people in recovery try to do it all themselves. Yeah, they do. So they don't deal with their mental health because they try to deal with themselves. So how do they do that? A lot of people use, or they'll get their aunt's Klonopin, or they'll take a handful of any type of medication just to let them not feel.
I've always read that loneliness is one of the biggest triggers for drug use.
Well, so
being alone.
Lonely is in the top 5 or so. The number one cause of relapse overwhelmingly is relationships. It's not even close.
Go figure.
Relationships are absolutely the number one cause of relapse, tenfold. And then I think then you get to boredom, and then boredom, loneliness, and then not dealing with your mental health. But the number one is relationships, and
that's why we work on relationships, right, Rachel?
Yeah. That's our focus here.
Yeah. So that's it. So can I throw it out there? If anybody is in active addiction,
please do.
Or anybody knows anybody in active addiction, you can give me a call personally. My name is Josh Parker. The phone number at my place of employment is 304-972-6767. And we work with the mental health agencies. You don't even have to come to us. We will help you get into somewhere else. We just want you to not use drugs. And, we'll just take the one phone call, 304-972-6767. And our whole goal is not just to help you get off drugs, it's to help you stay off drugs. So we might help use the other resources local in the community just to do that. So, and that's just, and if you're a parent of somebody and just want to talk about how to approach it, don't watch MTV and try to get somebody with what are those things called? Intervention.
Oh yeah,
intervention.
Those are okay. Those are okay, but listen, don't think that works in your situation. Call us and let us try to help guide you. We will do whatever we can just to try to give you more information. So, once again, my name is Josh Parker.
Thank you, Josh, for joining us today.
So thank you for having me.
Yeah, and thank you for everything that you're doing in the community.
It's my pleasure. It is my pleasure. Some people, like my goal in life now is just to help people. You don't know what it's like when you're walking.
That's always been your goal.
Well, it's an amazing feeling when somebody from Walmart walks up to you and they're like, "Hey, honey, this is the guy that gave me my life back." And and it's just, and it's out of the blue. It really does change your life, and those are the moments you live for. It's just a great thing.
You live a very purpose-driven life.
Yes,
now I do. It's a great way.
I wish that the listeners could feel just like the energy, the passion, the compassion that I've been feeling while you've been talking with us today. It's amazing.
Yeah. Thank you so much. Yeah, it's the information never changes either. So I would love to help you guys and get your guys' professionalism with our patients.
Thanks, Josh. Well, thank you for joining us with True Vine Talks, and you have a good day.
Bye.
Bye.